Good morning and welcome to Caretaker's Corner, where we discuss everything that pertains to taking care of your elderly or disabled parents, your disabled spouses, and your adult disabled children. My name is CJ Young, and I'm the one that's here to try and give you as much information as I can. And this week, and possibly for the next couple of weeks, I'm not sure how many this is going to end up being, but we're going to discuss communication with our loved ones. When you're dealing with elderly or disabled individuals, there can be a abundance of issues when it comes to just being able to communicate, from simply just talking to not being able to talk at all. If a person has had, there are all sorts of medical issues that could do this. You could have a person that's had a stroke, dementia. Medications can cause a lot of memory issues, which can impede proper communication. I know, like with Barbara's condition, she has these massive attacks, and after these attacks, she may or may not be able to talk for a period of time. And communication is really difficult because she can't, not only can she not talk, she can't really move. So some of our more typical ways of communicating, such as texting or anything like that, is just not an option. Individuals that have had strokes. I have a acquaintance at work, and her brother had a stroke, and it affected his speech. So he thinks he's talking quite plainly, and he's talking gibberish. And it frustrates him, and it frustrates his family, and then it just creates a lot of communication issues and stress and anger and all sorts of other emotions between both the caretaker and our loved ones. Now, I know that we already have a lot of stress, anger, emotions run rapid when we're talking about caretaking, both for our loved ones and us. Our loved ones because they feel like they're a burden upon us, and us because we're getting stressed because they do feel like they're a burden on us. And there's a lot of guilt going on. There's a lot of just tension. If you're like most caretakers, you also work a full-time job as well as take care of your loved ones. Emotions everywhere. And then when you throw in not being able to communicate, and it's not intentional. It's one of those things where we're trying to come up with ways we can communicate, that things can get through, but there are gaps. And even if you set up the best of systems for this, it may not. There's still going to be issues constantly. We've got different ways here in our household that we rules, kind of systems that we've set up for communication, and even sometimes those fall through. So I think this might actually end up, like I said, being more than one video. When it comes to communication, there is just so much to unpack. When I started thinking about this video, I was like, there's just, it started out as, we'll just go over the basics of communication and communicating skills and active listening and passive listening and body language. We're going to discuss all that because that's very important, not just with your loved ones, but in life in general. But then there's we've got a lot of extra ways in our household of communicating because, like I said, there are times Barbara can't communicate. She'll have an attack, and it will literally leave her, because it's mainly focused around her head, it will leave her where she can't talk for maybe 30 minutes, maybe an hour. I think we've had it up to 4 hours before. And it's both frustrating and obviously painful. As I've mentioned, my friend at work with her brother who recently had the stroke, and he cannot talk, but he swears he's talking. And then he refuses, once again, back to the emotions. He refuses because in his head, he's talking just fine. So he doesn't like going to speech therapy, which creates all different, issues as far as back to the emotions, the anger, the tension. He's mad because nobody's listening to him, but he doesn't understand, no one can understand him. And when they, he understands perfectly what people are saying, but when he, when they try and tell him you have to do this, he's like, I don't want to. So it creates a bunch of issues, and communication is it's one of the basic parts of life when it comes to interacting with other people. And when that is inhibited for any reason, it can cause misunderstandings. It can cause hatred. It can cause fights. And like I've already mentioned, tension and stress, emotions run high. So we're going to talk about different issues that might impede communication, and then possible ways of understanding how to, setting up systems for communication. Also, we'll go over the basics of communication, such as I mentioned before, active listening, passive listening, empathy, nonverbal and verbal communications, body language, and emotional intelligence. And that last one's the one that almost everybody can always improve in, and most people are lacking. And I'm not trying to use that as a bad thing. When I get to that, I'll actually give a really good definition and explanation of emotional intelligence. But in all honesty, it's something that we all need to work on. And the problem is, you've got us as caretakers who can work on it, and in most cases, our loved ones cannot. I have another friend at work whose mother and father, she takes care of both of them. They're not only elderly but also disabled. Her mother is on a lot of the same medications that Barbara is. So you've got a lot of memory issues because of the medication. And then because of her condition, she has some issues with that. And then you get something as simple as a UTI, a urinary tract infection. And in elderly people especially, UTIs can be a terrible issue. It can cause confusion. It can cause anger. It can cause massively bad. For instance, Barb's dad was in the hospital and got a UTI while he was in the hospital. And he got combative. Now, this is a little dude that's like 168 pounds, little old guy. At that point, the Parkinson's had gotten so bad that, he could barely walk. He couldn't open up bottles or anything. But in the hospital, they had to have somebody on both sides of the bed holding him in bed. We weren't there at the time. We had to go out of town, and we were having, they were calling us. We were rushing back so that we could get there, because he said he was leaving and he was going to go drive, and he was getting ready to walk down to the car, his sister's car, and take off. A few facts: at that point, he really couldn't walk very well, and he hadn't driven in years because we had to take his license because he kept having car accidents. So a UTI can be, in the elderly, can be very detrimental. And because of that, it causes a lot of issues where your loved one does not understand what you're saying, what you're asking, and they are totally confused and in another world, and they may not necessarily know who you are. Another issue that can be create communication issues, especially in the elderly, is dementia. Now, this can be Alzheimer's, or this can be any other form of dementia. I know as we all age, we get some memory issues. And I know I will sit there and be in a conversation and totally cannot come up with the word. But that's not what I'm talking about here. I'm talking about people that suffer from, like, Alzheimer's. And an Alzheimer's patient can know perfectly well how to get up and sweep a floor, clean a house, and they can be talking to you one moment and know exactly who you are, and the next moment not know who you are, be screaming and yelling that you have broken into their house, that you're stealing their food. And I know this as a story because Barbara's grandmother had Alzheimer's, and her daughter lived with her to take care of her. And she kept calling my Barb's mom, my mother-in-law, Wilma. She kept calling her and telling her that some woman had broken in the house and was stealing all her food. And it was her daughter. So when you're dealing with dementia, it's really hard to communicate. They don't necessarily remember things. They can remember what happened 50 years ago, but they cannot remember what you said 5 minutes ago or what they said 5 seconds ago. And that memory issue creates communication issue because it is hard to communicate with somebody and keep up if they can't remember. Barb, because of her medicine and her condition, has a lot of memory issues. And so when we're having a serious conversation, I record it on the phone. And I mark in my little description what we were basically talking about. When she goes to the doctor because of this, and sometimes she can't quite grasp what they're saying, I've asked all the doctors to allow her, if I'm not there, to record the appointment. So that way I know exactly what they said and what they discussed and what's going to happen. And that helps on my end with the communication, because then I can go back and I can help explain it to her. And we're going to go over in this series, because looking at the time, it will be a series, different ways like recording that can help improve communication, putting into place different systems. And when you do this, it is going to fall upon you as a caretaker to help remind your loved ones exactly what those systems are, and any of the, whether it's anything that I suggest or something else that you find that works, implementing any of the using products, using technology, or just using rules of communication to help improve communication, you're going to have to be the one to remind your loved ones about that, because they're not going to remember, or they're not going to be able to function with it in the beginning. And you'll have to continually teach them and remind them. So I hope this has kind of helped out and will give you some hope. And I don't know how many videos this will be, but I do see it as being a series. Because, like I said, and I know in our household, some of the biggest tensions and fights that we've had, particularly in the caretaking area, is among communication. And I know that with my dad, when he was not having any problems and he was healthy and his blood sugar was good, no infections and all that, our communication was great. We had certain things we wouldn't discuss because we were totally opposites and we knew it was going to get in a fight. But we also had good communication in every other area. But when his blood sugar got all hinky, he would be very baby-like, and that would create an issue. When I first got him, he was retaining a large amount of water, and he had infection in his legs and everything. That created communication issue, because once again, back like to the UTI, an infection in the body affects the mind, especially in the elderly. So we're going to kind of hash all this out over the next few videos, and I hope you have a great day, and I hope you have a great week, and I can't wait to see you back here next Sunday. Please be sure to like, subscribe, and share. And if you have any thing you want me to discuss, please put it in the comments. Also, if you have any stories about communication horrors or communication ideas that you use to help with communication in your family and with your loved ones, please put it in the comments so we can either include it in one of the videos or at least hash it out in the discussions. All right? Love you guys and have a great day.